Hi, I'm Dr. James Sturm. I'm an interventional pain physician that founded Arch Advanced Pain Management. I practice in the St. Louis, Missouri area. I wanted to create some videos to educate my patients and other pain sufferers about techniques that hopefully can get their pain under better control. Today's topic is on spinal cord stimulation. Spinal cord stimulation has been around for a lengthy period of time. Norm Shealy, a neurosurgeon from Missouri who trained at Harvard, helped invent and implant the first spinal cord stimulator system in Wisconsin in 1967. I completed my pain fellowship at the Cleveland Clinic in 1996. At that time, spinal cord stimulator generators could only supply electrical current to 4 leads. Spinal cord stimulation involves placing electrodes or metal contacts within the epidural space. It involves the transmission of electricity to help block pain that travels to the brain. The epidural space is the same space that we place a catheter in laboring moms to help block labor pain. Instead of using numbing medicine that the laboring moms receive, we use an electrical current. There are 2 parts to a spinal cord stimulator system. The first part is the generator, and the second part are the leads or the metal contacts that go into the epidural space. Spinal cord stimulators are a unique, or one of a few unique medical procedures that actually you go through a trial before committing to the actual full procedure itself. The wires for the trial and the permanent implantation go into the epidural space through one of the openings. And the wires during the trial come through the skin. We tape them to the patient, and they go home for several days. During that period of time, the patients can see if the electrical stimulation can block their usual pain. The stimulation feels like a vibratory or a tapping type sensation, and that we hope will block their usual painful episode. The trial is usually for several days. Spinal cord stimulators can help cover pain for failed neck or back surgery, sciatica, pain that goes down an extremity, post-chest wall surgery pain, shingles pain, and atypical trigeminal neuralgia. There's a variant of spinal cord stimulation where the same leads are placed along major nerves. Transmission of electrical current can hopefully block the pain from those damaged nerves or entrapped nerves and give patients pain relief. If a patient has a successful trial, then they can go on to permanent implantation of the spinal cord stimulator system. A successful trial is considered 50% improvement of the pain. I've had many patients obtain excellent pain relief with spinal cord stimulators. There are 3 companies that make spinal cord stimulator systems presently in the United States. A 4th company called Nevro, in conjunction with the Mayo Clinic, and the devices are produced in California, are commercially available in Europe and in Australia. If a patient has a successful trial and wants the device placed, it is surgically implanted. Again, the leads are placed into the epidural space, behind the sac that contains the spinal cord, in the chest spine for low back pain, and in the neck for patients who have neck pain and arm pain. Once the incision is made there, the generator is implanted. The generator is often placed in the buttocks area, above where a patient would sit on, but below the belt line. So when the leads are placed, an incision is made during the permanent implantation, and the leads are sutured to the ligaments of the spine. A second incision is made for the generator. A hollow tube is placed from the lead incision to the generator incision, and the wires are brought down to the generator. The wires are connected to the generator. The screws that connect the wires to the generator are tightened, and both incisions are closed. I have my patients come back in about 7 to 10 days afterwards to remove their staples. During that period of time, I ask my patients not to bathe or shower. They need to keep their incisions clean, covered, and dry during this period. After the first 2 months of implantation, I ask the patients not to lift overhead or lift more than 10 pounds to allow the leads to scar in. The generators are rechargeable with all 3 commercially available companies. Radio waves travel through the skin to the generator. The radio waves are converted to electricity and then stored in the internal battery. The generators can last for many years, for most devices, or at least 9 years. Medtronic has come out with a system that is MRI compatible under certain conditions. If patients are going to have an MRI, they have to follow those certain conditions during the scanning process, however. Boston Scientific has come out with a 32 contact generator, and St. Jude Medical has leads that are going to cover the dorsal root ganglion. This hopefully should allow for more accurate stimulation of more specific areas. Spinal cord stimulation in some of my patients has been highly effective. It's allowed them to regain their lives, reduce their pain medications, and not focus on their pain on a day-to-day basis. I hope this information in this video has been helpful. Again, I'm Dr. James Sturm, founder of Arch Advanced Pain Management in St. Louis, Missouri.